Everyone, Dr. Brianne Callanan here. I'm a naturopathic and functional medicine doctor, and I help individuals get to the root cause of their hair loss. In this video, we're going to go through a case of iron deficiency anemia, what we did, as well as a GI map stool test. For many cases of chronic iron deficiency anemia, I like to run a comprehensive stool test called the GI map test, especially if you've been supplementing with iron and it just doesn't seem to be working. Now we're going to go through step by step, and we're going to share what the results came up for her, because we did find one of the root causes as to why her iron was low in the first place, as well as why she was not responding to supplements. So let's go through the blood work first. So as we can see here, this was her starting blood work. Her ferritin started at a 19. In order to stop hair shedding, I like to see a ferritin greater than 30. And then in terms of optimal levels, an optimal ferritin is 70 to 100. Ferritin tells us about the stored form of iron, how much iron is in your reserve in order to do nice to have things for the body like grow your hair. So this individual, yes, she's within this normal range, but again, normal ranges do not mean optimal, especially when it comes to hair. You can see this range is extremely broad, and she was only at 19. Now, we did start simple. We started with an iron supplement, as well as cofactors that help with iron absorption, such as vitamin A and copper. So she did an iron supplement, and then we chose a desiccated beef liver for the sources of vitamin A and copper. We also talked about nutrition. How can you incorporate more iron-rich foods in your diet? Foods that are high in vitamin A, foods that are high in copper. After 3 months, again, it's really important that you repeat your blood work to see if it's working or not. In her repeat labs, her ferritin was only up to 26. There has been an improvement, but not as high as I would typically see an improvement after 3 months, and she was using the supplements consistently. So what did we do for next step? We ran a comprehensive stool test called the GI map. This looks at the gut microbiome to determine, are you absorbing your iron? Do you have gut infections? Is there anything else, inflammation in the gut, leaky gut, that could determine or provide insight into why she was not absorbing the iron supplement as efficiently? So here's her GI map stool test. Whenever I look at a GI map test, I actually scroll down to the very last page of the intestinal health markers to get an idea of the gut health overall. Steatocrit tells us about the amount of fats in the stool. You should be digesting and absorbing all of your fats. That looks great. Now, elastase tells us about pancreatic exocrine function, meaning pancreatic enzyme stomach acidity. This is definitely not optimal. I like to see it above 500. So we need to figure out, okay, if you're not digesting and absorbing your foods, why is that? Things like not chewing your foods, chronic stress, not having enough digestive enzymes, gut infections like H. pylori can lower this. So this is the first sign that, you're not digesting and absorbing things as efficiently. This could be why you're not absorbing your iron. The other marker that came up low here is secretory IgA. This is the immune system in the gut. So when immune system is low in the gut, or the secretory IgA is low, I'm looking at nutrient deficiencies like zinc and vitamin A, but also chronic stress. I see it a lot with. So we want to support the immune system, and we want to improve digestion. Inflammation, I don't think a 66 is too high for the calprotectin. Maybe a little bit of inflammation in the gut, and leaky gut a little bit there at 147. That's the marker of zonulin. Now, scrolling back up, why is she not digesting things as efficiently? Worms and parasites were not detected or below detectable limits. Virus, fungi, all great. She did have a little bit of bacterial overgrowth. This can cause in some people bloating, some individuals more loose stools, some individuals more constipation. Proteus in particular has been associated with inflammation. So we want to treat these, but we also have to ask the question, why? Why are the bacteria able to overgrow? She's not digesting her food. She doesn't have good stomach acid. She doesn't have a good immune system in the gut. That could be why these are able to grow. The most important thing, we're going to get to it in a second, kind of the root cause of the iron deficiency anemia. This is the normal gut flora. This all looks great. Like, I don't see any need for this individual to have a probiotic. The normal flora looks wonderful. Okay, this is the problem for this individual. H. pylori is a bacteria that lives in the stomach. 50% of the population can be carriers. This is transmitted person to person through saliva. She does have higher levels of H. pylori. She also has a particular strain of H. pylori with virulence factors. This, whenever I see virulence factors, I definitely want to treat this regardless of the level. H. pylori, what it does is it lowers the stomach acidity. so that it can live in the stomach. And if you lower your stomach acidity, you're not going to absorb key minerals like iron as efficiently. This bacteria can also cause changes to your appetite, bloating. It's been associated with acne and autoimmune thyroid conditions such as Hashimoto's, unexplained hives. Even increased prevalence of anxiety and depression has been associated with this bacteria. It's not causative, but we tend to see it go hand in hand. So this is something that we definitely want to treat. In order to treat this, there is conventional treatments that involves proton pump inhibitors, bismuth, antibiotics, but this particular strain of H. pylori is really resistant to the conventional treatments. Now, the reason I know that is because we can scroll down here and look at the antibiotic-associated genes. Now, what they do is they take the strain of H. pylori, they grow it, and then they expose it to different types of antibiotics. She has a lot of resistance to antibiotics, so the conventional treatment likely won't be as effective for her. So what we decided to do instead is a natural treatment for the H. pylori that includes bismuth, but also mastigum, oil of oregano, probiotics, and a fiber. This is the root cause for this individual. We're going to treat this, continue with the iron supplement, and then see if she has a better response. We also need to support the adrenal glands and the stress glands because her immune system was a little bit on the lower end, and then we'll see how she does. In terms of long-term, we're going to supplement with the iron for another 3 months, repeat the blood work after we treat this infection. So test, don't guess. I really think a stool test is valuable, whether you're dealing with hair loss or acne or digestive concerns, autoimmune conditions, low immune function. So much of our health begins in the gut, and I think this is a wonderful test for individuals to consider.